Salamat again. Thank you very much. Before I start, I'll try to be as quick as I can, pero uh, um, I don't want to sacrifice the content. But before I start, I'd like to say that I declare no conflict of interest. No? Kung ma-mention man po akong produkto ngayong hapon, wala po akong stocks or any financial interests or relationships with any manufacturer of commercial products, even ng RUTF or ng therapeutic milks, etc. I am with a non-stock non-profit organization called Kalusugan na Mag-ina, and our mission is to promote and protect the health of the mother and child diet through research, policy development, and because that's how I met Leah and Dr. Judy, training and program implementation to help the Department of Health and other health agencies. Dr. Judy asked me to give a few slides, to deliver a few slides on what is called nutrition governance, no? Ibig sabihin yung frameworks for what we are trying to do with the PMAM program that you have heard about over the last 2 to 3 days, no? And because I don't have a lot of time, I'll just go over what is called AO number 2015-0055. This is a Department of Health administrative order, and like all AOs of the Department of Health, they cover both the public and private sector. No? So we do have clinical practice guidelines on the management of acute malnutrition for children under 5 years. And these are encompassed or mandated in this AO back in 2015. Our group was engaged to develop the capacity building training workshops initially for SAM and now also for MAM, but I don't think MAM was in the curriculum of this particular webinar. So, ito po yung mga general objectives ng AO to provide the policy, strategy, and standards to health, nutrition, and social service providers. I see there are so many participants in this webinar, and I'm very, very happy. And I hope that beyond pediatricians, there are also other health professionals here, maybe nurses, maybe social workers, nutritionists, dietitians, hopefully in both the government and civil society organizations, or in the private sector, kahit hindi ho organized into NGOs. The specific objectives of the administrative order of the DOH are to provide evidence-based. Dapat may ebidensya, hindi lang yung bili tayo ng bili ng commodities or ng gamot, or we devise programs na walang pinagbabasihan na ebidensya. We have tried to promote standard evidence-based protocols for the management of moderate acute malnutrition and SAM. But not just that, hindi lang training ng training, dapat we should enable the environment, para yung alam nating mabisang mga protocol ay maipalaganap natin at talagang makakasalba po tayo ng mga buhay, So, not only that, we also want to, number 3, standardize and integrate the indicators para ma-monitor natin, Are we just training? Are we just treating? Pero actually, default lang ng default o mataas lang ang mortality rate, And we have to define the roles and functions of all the stakeholders involved, whether it's private pediatricians like members of the PPS, or other government workers in rural health units and regional health offices, and even in the community, because you learn that we can treat SAM effectively in community-based OTC centers. So I'm pretty sure that in the lectures over the past 2 days, you have heard about the multi-sectoral approach that will ensure the access of all these poor families, to all the interventions that we're talking about. It's the PMAM program abroad. It's called C-MAMI, meaning community-based. Really is a public health strategy. Nung kami nagpe-pedia training, we only learned about treating kwashiorkor and marasmus at that time, in the hospitals, no? And we were very, very frustrated with the high mortality rates. And I don't know, maybe some of our participants might be in my generation, no? Na naabutan itong mga babies at children na ini-endorse natin buhay naman at somehow gumaganda ang facial expressions, no? But when we come back in the morning, namamatay na, patay na, no? From who knows what at that time. But now we know that it's probably because we overloaded them at cardiogenic shock or some other health failure issue, no? And the program has to be integrated with other health and nutrition services. It has to have a strong community component, and that's why pediatricians like Dr. Leamore are so important in this battle, no, against severe malnutrition. We have to link with other sectors, and there are guiding principles to do so, no? I'm sure that over the last 2 days, you've learned about what is OTC, what is ITC, what are the new interventions, no? What's the importance of community mobilization, no? In catching these families with SAM children and making sure or ensuring that their care is sustained even in OTC. So I won't go over this much anymore, okay? So this is where the linkages are very, very important. It's not just having RUTF, no, at our fingertips, no? And at times, even when there are stockouts, we will realize that it's a whole systems approach. Dapat may access to information, mothers and caregivers, dapat alam nila, may awareness sa community, no? May integration in all the health programs to ensure continuity and access, no? Tayo mga private sector pediatricians, may tendency na hindi tayo masyado nakiki-interact and nagko-coordinate, no? I say a tendency, but I'm sure many of the local chapters and probably lalo na ang Northern Luzon, napaka-integrated ang inyong trabaho with your regional and provincial health offices, no? It requires capacity building. We need to deliver, we need to provide not just any old care, no? It has to be quality care. Kasi kung hindi, magde-default lang din, no? Mamali ka lang ng salita sa counseling, hindi na yan babalik sa atin, and we'll never be able to get our indicators better, no? We have to, and this is what we're working hard with the DOH to do, pero naipit tayo ng COVID, no? Supply management and utilization, the supply chain of all these therapeutic milks that you learned about, RUTF, RUSF, information management is very, very important. And we're trying to build in these indicators into our electronic information systems with the Department of Health and even with PhilHealth, no? So it's a lot of coordination. Like Dr. Leamore mentioned, the highest stage of behavioral change is actually advocacy. And we hope that the advocacy is not just among the patients themselves who benefited from the programs, but also from pediatricians, no? Go out of your private clinics and become advocates for all that we're fighting for, no? So I hope by now that many of you have heard about what is called the critical 1,000-day window. But if you've not heard about it, then I'll present a few slides later. Okay, this is actually a little bit old slide. As you'll notice, now under universal healthcare, we call service delivery networks healthcare provider networks now, not even interlocal health zones, but health care provider networks, or HCPNs. And the work to strengthen these networks is going at a furious pace. We should have started UHC in January, pero unfortunately, naudlot. But at least by way of these webinars, we're able to cushion, no, the collateral damage that is happening to our essential services dahil dito sa COVID pandemic, no? So this is the first 1,000 days. It's a campaign, but it's also now a law, no? Republic Act 11148, or the Kalusugan at Nutrisyon ng Magnanay Act, actually mandates local governments now to invest in, ibig sabihin, maglagay sila ng pondo para sa nutrition programs in the first 1,000 days. We're not talking about school feeding programs. We're talking about nutrition for pregnant mothers, for young infants and children up to 2 years, no, is what is defined as that critical period. Now, even if we try to compensate for the damage that was, or the injury that was inflicted on these children during pregnancy or in the first 2 years of life. Even though you try to compensate and overfeed them, it's not going to matter, no? Kasi irreversible na po, non-compensable na po yung damage na nangyayari in these first 1,000 days. These are old figures, but you can see your figure there for CAR and even for the Ilocos region if other participants are from adjacent regions of Luzon, no? So mataas pa, no? We are trying to drive our wasting prevalence to less than 5%, no? And if you see all across the country, marami pa ring regions na mataas sa 5% ang SAM, ang severe wasting. So it is a critical health priority. It should be a health priority even of your local government units, not just of pediatrics, no? So dapat nandyan ang advocacy and our mobilization ng communities. Okay. That was maybe 5 minutes of nutrition governance, it's called. And I actually asked for permission to talk about something that is very, very important to us. It should be, no? As we were engaged by UNICEF and the Department of Health to formulate the training courses for SAM, we asked them why can we include severe acute malnutrition in infants less than 6 months, no? Unfortunately, at that time, there were no CPGs for infants less than 6 months. So our contract with UNICEF did not allow us to develop a training course without CPG. But we did ask permission from UNICEF headquarters to look into SAM in less than 6 months of age. And when we did our literature search, it turns out na kapag ginugal ninyo ang SAM in infants less than 6 months, baka wala kayong makuha po because it's called C-MAMI, C-MAMI, which stands for community-managed, community-based management of acute malnutrition in infants. So yun po ang C-MAMI, okay? And there is actually a C-MAMI working group that works internationally, no, to generate the evidence for our protocols, okay? So the objectives, hopefully I can finish in the next 30 minutes maybe, is to talk about suboptimal breastfeeding first, no? To talk about SAM in infants less than 6 months here in the Philippines, and to hopefully introduce to you, or if you are already familiar with the so-called C-MAMI tool that's available on the web for free, no? So I am sure this slide is probably familiar to you, having been in your lecture number 1, probably module 1 or module 2, about the types of undernutrition, no? And for the pediatricians here, this is based on the Lancet Nutrition series of 2013, no? And they list here the types of undernutrition. I'm starting from micronutrient malnutrition, the number 5 type, no? And I have a reason for it, a hidden agenda to do so. But I will not be discussing this in any great detail ngayong hapon because I'm pretty sure as pediatricians or as pediatric nurses or even midwives that you're familiar with these micronutrient deficiencies. In the picture, you see a case of severe vitamin A deficiency with xerophthalmia and proceeded to corneal scarring. At one point in time, it was actually the number 1 cause of blindness in Filipino children, no? Yung severe vitamin A deficiency. But I'm not going to talk about that. I do want to say that that there's a very popular commercial on TV, no, that sings micronutrient deficiency, and even children know how to sing it. And that's my pet peeve, no? Now the advertisements pick up these keywords and use them for commercial purposes. And I hope we don't allow these things to happen, that this particular type of brand of milk is the answer to micronutrient deficiency. It's not, no? It is not. Number 4 type of malnutrition is acute malnutrition, and this was the content of the majority of your lectures mula the other day, no? What we call acute malnutrition or wasting, no? And I won't belabor the definitions anymore here. There is also chronic malnutrition or stunting. You'll hear about this a lot in the next few years because basically this is the decade. It is the decade of nutrition. Itong 2020 2020 onwards, no? So you'll hear about wasting and stunting a whole lot, no, in our national targets to improve the health of our children, no? So number 4 and number 3 are acute and chronic malnutrition. Number 2, I illustrated in blue to emphasize what I wanted to talk about, no? In the Lancet series, no, by Black and his colleagues, no, Lancet is a very reputable health journal, and they pushed the agenda that suboptimum breastfeeding or breastfeeding not up to standard is in and of itself already a form of undernutrition. And I'd like to say that again, it is already a type of malnutrition, of undernutrition specifically, because it has been pinpointed to be responsible for 800,000 child deaths across the globe. No, being already in itself a type of undernutrition, it carries with it the urgency. No, it carries with it the urgency, same as SAM, same as wasting. No, because it is a precursor to death. No, in very young infants. No, and we'll talk about that again later. No. Going to number 1, fetal growth restriction for the pediatricians here and or neonatologists, yung alam natin po dati na pinangangalangan intrauterine growth restriction. It used to be intrauterine growth retardation or IUGR. And these are the fetuses or the eventual newborns that are born pwedeng low birth weight or basta't hindi na nasunod ang kanilang growth potential because of either nutritional undersupply in the uterus or chronic medical illness like chronic hypertension or preeclampsia that constricts the blood supply to the placenta. No? So it's not just kwashiorkor malnutrition, it's not just stunting, but it's also suboptimum breastfeeding, and it's also fetal growth restriction that contribute in very dire terms to our problem, our huge emergency that we call undernutrition. Okay. Many of you may have already heard about the first 1,000 days, no? But some of you may have heard it framed in an old formula, like 270 days, which is pregnancy, 9 months times 30 equals 270. And then yung kasunod sa equation, 365 times 2 to represent the 2 years. But we would like to frame the formula this way. It's 270 days of pregnancy plus 180 days or 6 months of exclusive breastfeeding plus the rest of the 550 days up to 2 years of age or beyond. If the family, if the mother and the child choose to do so, breastfeeding can continue beyond 2 years of age. So ito ho yung framing natin. If you'll notice, the first 1,000 days is equated to pregnancy plus the days of IYCF, or infant and young child feeding. For those of you who haven't heard about the global strategy for infant and young child feeding, no? So IYCF, okay? What is very important in the campaign for the first 1,000 days, no? Stunting doesn't happen overnight. You can't have acute gastroenteritis and then tomorrow you're stunted na, no? Stunting happens very early in life during the first 270 days where the fetus itself can be compromised already, the baby's born low birth weight, and then the infant and young child feeding practices that are known to be evidence-based and effective for the growth and development of young infants and children to optimize their outcomes ay nakokompromiso because of any other factors, no? The problem with the first 1,000 days is if you do not intervene in those critical days, the damage, the injury, the insult that was inflicted on the fetus and the young infant cannot be reversed. Why? Because this is the time when especially yung brain development, no? Yung maturation, yung multiplication ng neurons at yung synapses between the neurons are at their most rapid pace, no? No other developmental phase is characterized by this rapid brain development, as in the first 1,000 days, no? The next period where the brain development might be at its fastest, no, would be adolescence, no? And then by the time you get to my age, yung brain cells ninyo medyo nag-atrophy na, no? Medyo nawawala na kapag hindi natin nagamit, no? So very, very crucial to intervene in the first 1,000 days of life, okay? Ang ating low birth weight rate, a few years ago, it was still 1 in 5 Filipino newborns weighed less than 2.5 kilos or about 5.5 pounds, no? Pero bumaba na yan po ng konti. It's in the high teens now. And we hope that we can continue on with our decrease in the low birth weight rate here in the Philippines, okay? Very shortly, I just like to talk about the very beginnings that we're talking about, no? So nakikita niyo po sa screen yung the point of fertilization, no? The point of conception, which is basically day 0 of the first 1,000 days, no? I'd like to just really very shortly ikwento ko lang po yung isang what is called a 70-year cohort in an African nation that's relatively poor, the Gambia, no? Dun sa bayan na yun po, sa bansa na yun, the Gambia, they have only 2 seasons. The dry season and the wet season, no? And what they found, they is the British Medical Research Council and the London School of Tropical Medicine and Hygiene, sinundan po nila ng 70 years, ang the Gambians, no? And they looked into the relationship of dying in the adolescent years to not the day of birth, not the illnesses in childhood, but they correlated it with the time of conception of these Gambians, no? And what did they find? No? They found that the Gambians that were conceived in the dry season, kapag walang ulan at walang makain na leafy, fresh, green vegetables and fruits, dito sa dry season, kapag na-conceive ang fetus doon, the chance of those fetuses dying when the maternal diet is very scanty in leafy green vegetables, they tended to die at a much higher rate, no? So yung panganib nila mamatay sa teenage years mas mataas, no? It's not when they were born, it's not their neonatology care, but when they were conceived. And what does this relate to? Tayo as pediatricians now, we have learned about epigenetics, no? You are born with the genes of your parents, but how your phenotype is expressed, how you become as an individual, your physical attributes, your personality, etc., are probably affected by the early environment in which you were grown, no? So as a fetus, kung kulang yung pagkain na dumadating sa iyo across the placental barrier, then what happens, and it used to be just an intrauterine programming hypothesis by Barker, but now this has been demonstrated again and again, no, in population studies, that if you are undernourished as a fetus, instead of dying, your enzyme systems, your neurohormonal systems will down-regulate para hindi ka mamatay. So the enzymes that are responsible for absorption, digestion, etc., of these nutrients coming from your mother's womb, no, will down-regulate para hindi mamatay. You are born low birth weight. But the problem is, if you are born low birth weight or fetally growth restricted, and you are made to catch up growth really fast, loaded with formula, no, made to eat McDo and all these cholesterol-laden foods, no, and trans fatty acids, no, ang problema, your organ systems, your liver, your spleen, your kidneys maybe, have been down-regulated and don't know how to use these nutrients, no? So here in this slide, you can see the Dutch birth cohort famine results. Now, if a young embryo was conceived at the time of the Dutch famine, no, nung embargo in Germany, they were 2 times more likely to develop heart disease in later life. And the same patterns can be seen for the higher risk of schizophrenia, for obesity, for diabetes, for cancer, and stress-related illnesses, no? Marami pang iba, pati yung Framingham study, no? and the relationship to what is called the metabolic syndrome or the overlap syndrome between overweight, obesity, diabetes, and coronary artery disease, nandun pala sa pinaka-beginnings and how we choose to feed our infants, no? Kapag hindi naman nila kayang i-absorb at i-digest, i-metabolize yung nutrients na yon, nauuwi lang sa sakit, maybe later on in life as adults, no? Unfortunately, yung pregnant mothers natin, medyo at high risk din, no? A little bit old data was that 1 in 4 Filipino pregnant women are anemic. This is a little bit old, no? When I talk to midwives all across the country about what nutritional messages do you give to your pregnant mothers during their prenatal visits, and most of them said iron and folate, no? But I can count on my fingers lang ang nagsabi na pinag-usapan nila ang diet ng pregnant mother, no? It's important that dietary counseling is included during prenatal visits, framed on the 1,000 days, talk about balance, variety, and moderation. Hindi naman kakaya na malunggay araw-araw, but the important thing is that there's a variety of sources of calcium, of protein, and of the other vitamins and minerals. Very often forgotten is the message about avoiding tobacco exposure. Smoking is a very strong correlate with fetal growth restriction because of the hypoxia to the fetus, no? And of course, to avoid secondhand smoke and also heavy alcohol exposure, no? Alam natin yung fetal alcohol syndrome, okay? We talked about intrauterine programming already. I won't belabor this anymore. And of course, we talked about the metabolic syndrome. And it's not about lack of exercise lang during teenage or adult life. It goes back. It goes back to the first 1,000 days. And many population studies are showing this now. It's how we're feeding our young infants and our children na hindi kayang abutin lang or i-reverse lang ng ipa-exercise mo o ipa-fast mo, ipa-diet mo yung obese na child, no? So it's very, very impactful now what the evidence is showing, okay? It's very sad that these are our breastfeeding statistics at the time of birth. Only 1 in 2 newborns are able to complete the first breastfeed. At 6 months of age, nagiging 1 in 3 pa yan, no? Kasi they're falling off, no? Yung mga mothers returning to work stop breastfeeding or are limited by their work environments from continuing, no? There's a little bit of good news here is that at 2 years of age, 1 in 3 pa rin ang nakakapag-breastfeed, no? So it looks like if you have limited human resources and funding, concentrate your breastfeeding counseling on the early months, no? On the early weeks, and especially the primiparas, no? So that they can initiate the breastfeeding properly, and hopefully they will continue up to 2 years or beyond, no? I cannot overemphasize the importance of the first embrace, no? Or this started with us, no? In our country, yung unang yakap kung tawagin, wag po natin ihiwalay yung baby, no? It's very, very important. It's not just about bonding. It's just not about a cute picture. That you keep the baby in skin-to-skin contact uninterrupted so that that baby can complete the first breastfeed. Because there are very, very many global and long-term impacts of being able to achieve that first breastfeeding. We have tried to go around the country and even to other countries to try to push the simple behavioral changes that health workers need, no? Don't suction them kaagad, don't clamp the cord agad, do the right things at the right time, which is 1, immediate and thorough drying, 2, early skin-to-skin contact, 3, properly timed cord clamping, and 4, non-separation of the newborn from the mother para maumpisahan na yung napaka-crucial na first breastfeed na yon for ingestion of colostrum and stimulation of the mother. The DOH has integrated programs, no, across the continuum of care para mapahalagahan, maprotektahan, mapromote, masuportahan ang breastfeeding and complementary feeding na proper, no? We have legislation nationally, no? The Milk Code. It is a code against marketing. It is a code against marketing. It's not a code that will jail mothers because they are not able to breastfeed. It is a code against marketing because we know the impact of giving free samples and health workers receiving gifts, no, from milk companies na nagka-conflict of interest po talaga. So that's their business, but we have to remember our business is to save lives, no? So sana po an appeal na please respect the milk code and respect what it stands for as even private pediatricians, okay? We talked about suboptimum breastfeeding. Sabi natin, it is breastfeeding not up to standard. And what is the standard? It is IYCF. No, the global strategy recommends that exclusive breastfeeding starts at birth within the first hour. Exclusive breastfeeding continues up to 6 months, at which time complementary solids using locally available solids and fruits and vegetables and sources of protein are initiated, no? Pero the message that is often lost on us, even us pediatricians, is that breastfeeding should be continued from 6 months up to 2 years or beyond, no? If the mother and the baby choose to do so. It does not mean that at 6 months you start formula, no? For us to be able to optimize the outcomes of our children, no? It is important that these IYCF practices, evidence-based, appropriate, are implemented, are adhered to, no? So the question remains, if breast milk contains all that babies need, why are there breastfeeding infants less than 6 months of age that have SAM, no? And I alluded to the fact that suboptimal breastfeeding does happen, and it happens for many reasons. In our training workshops, we have open forum or audience participation. Pero here, I will just tell you the usual answers, which are correct, no? Ano ang suboptimal breastfeeding practices? Number one, mixed feeding is suboptimal, okay? So if the mother is breastfeeding but requiring formula to top up, that is already suboptimal breastfeeding. Why? Because we know that her own breast milk supply will peter off, no? Kasi may ibang sumisingit na formula, nabubusog ang baby, therefore hindi na stimulate yung breast to produce more milk over the next months of life, no? Formula feeding is suboptimal breastfeeding. Giving of water is suboptimal breastfeeding. Giving of condensada, evaporada, coffee creamer, any other white substance, just to giving of is also suboptimal breastfeeding. And this is the counseling that we need, no? This is the counseling we need from health workers that are devoid of conflicts of interest para talaga matulungan natin ang mga mothers natin, no? If you look at the graph and look at the figures in the rectangle at the bottom, no? Imagine dito sa Pilipinas, up to the year 2013, how is that? 13.4 of our 0 to 5 month olds already have wasting. Napakadami ho niya, no? So this just goes to show that our health system, our health workers, our pediatricians, our obstetricians, anybody who is involved in maternal and child care has a lot of homework to do, no? So we should help each other na bumaba ang SAM sa infants less than 6 months. Kasi yan din yung panahon na napaka-likely silang mamatay, no? If you look at the child survival strategy formulated in Bellagio, Italy, no? Breastfeeding is the most potent intervention to prevent child deaths, no? It can reduce child mortality before the 5th year of life by 13%. Kapag inad mo pa yung kayang i-reduce ng complementary feeding, that's 6% or about 19. Almost 1 in 5 child deaths can be prevented just by IYCF. If we just gave it the respect that it deserves, no, we can save more of our Filipino children. Okay, so just quickly, you cannot continue what you have not started. Please do adhere to Unang Yakap, no? Please do so. When the MAMI interest group across the world looked at the risk factors for SAM in less than 6 months, no? They did a secondary analysis of 20 demographic and health surveys, no? They found that early breastfeeding practices, faulty early breastfeeding practices contribute a whole lot. It's not just the mother's education or the mother's nutrition, no? It is the early breastfeeding practices that can contribute a lot. There are a myriad of misconceptions about breastfeeding, even among pediatricians, no? You'll hear pediatricians say, ay premature yan, ay meconium stain yan, ay may cleft lip and palate yan, hindi yan kayang breastfeed, no? And I just like to show this this video of a baby with cleft.
This cheek will serve as a cover on the affected side and direct the nipple towards the normal side.
So this is a baby with a right-sided cleft lip.
In an upright position.
And Dr. Jessamine Sereno of Cagayan de Oro was explaining how you can seal off,
if you're afraid,
that you can seal off the gap so that the baby can achieve a vacuum, no?
Here.
Okay, so this is the skilled breastfeeding counseling that we as pediatricians should be equipped with, no? Hindi dahil may congenital anomaly ang baby, ay hindi na yan pwedeng no? So practical skills in breastfeeding counseling are so very important if we mean to improve our breastfeeding practices and save our children, no? There are a lot of misconceptions na hindi daw pwede mag-breastfeed kapag may hepatitis B, kapag may tuberculosis, kapag may HIV ang mothers. All of those are misconceptions. We really should study what the guidelines are on these infectious diseases, no? A lot of times we get reports, nagsusumbong sa amin yung mga nanay, doktora, kinailangan kong mag-antihypertensive. Ay, nagka-UTI po ako, stinart po ako ng amoxicillin. And their breastfeeding was stopped. No, we as pediatricians should advocate that doctors should know which medications, drugs are not contraindicated, and the majority are not contraindicated. You can log on to LACTMed, LACTMED. It's a free database of the Library of Medicine in Bethesda. Just log it in, type the generic name of the medication, and you can check whether it's true na contraindicated. And in the majority of cases, hindi po contraindicated yung medication. Return to work, we have lobbied in the Senate and Congress, and our breastfeeding maternity leaves have now prolonged now, not just 60 or 75 days, nasa 100, 110 days na po. So that's our contribution sana na maituloy ng mother, makasucceed siya sa breastfeeding. Okay, I know I'm probably over time. Prematures, I have lots more videos here, but I have no more time. Prematures can breastfeed. This is little baby Amor, who was able to breastfeed kahit premature siya. This is a baby with Pierre-Robin syndrome. You can see the micrognathia, but you cannot see the complete cleft palate, no? But we, pediatricians need to learn how to cup feed, no? Nutritionists are cup feeding babies now. So congenital anomalies are not an impediment to successful breastfeeding. Okay, so I'd like to end with maybe a few slides, no? I'm sorry if I talk too much. These are my thoughts. Exclusive breastfeeding is a time of infant-controlled breastfeeding, no? Not like when a mom goes to work and inutusan yung yaya, o timplahan mo ng formula, consume 4 ounces every 3 hours, no? The baby is totally out of control. He does not know how to develop appetite regulation. Sleep is disturbed because of the gassiness. With breastfeeding babies, they're not subjected to the forced feeding, as in bottle and formula feeding. They are not subjective to a to an unchanging, sweet, creamy taste of formula over the 6 months. No? Kasi yung breast milk, nagbabago yung lasa, bawat kainin ng mother, nagbabago po ang amoy, and these odors of the foods that the mother eat, the babies are exposed to in their fetal life. So they develop an olfactory, they develop a gustatory memory for what they are exposed to in the amniotic fluid that they swallow and urinate, no? So these infants now are more likely to develop wider tastes and flexibility with solid feedings. Hindi ho sila nagiging pihikan, no? So they have better appetite regulation, they have better sleep regulation, they have better mood regulation. You'll see the babies who are breastfed are very self-regulated, no? Masarap matulog kasi may casomorphins in the breast milk, may endocannabinoids that regulate their mood and sleep, and there are nucleotides that differ in levels throughout the day and night, no? If you are expressing your milk and storing it, date and time the milk so that you give the nighttime collected milk at nighttime to help the baby sleep better, no? So these are very, very important things that reflect the fact that breast milk is a living, it's a dynamic product, no? It is not something that you 1:2, 1:3, and that's it, no? So avoid separating the product from the process breastfeeding if possible, but if not, then exercise some of these practices to help you continue. Breast milk, free daw, but that's not true. No, if you were to put a market price on breast milk, it probably costs about 3,000 to 5,400 per liter. Based on this, the Philippines loses an estimated $19 billion dollars, no, annually due to early weaning. So sayang naman, kawawa naman yung bansa natin. No, this is a breastfeeding in the workplace toolkit that you can download at that website, bit.li/BF Toolkit, no? So meron diyang mga modules for different parties, no? For workplace employers, for mothers, for families, for health workers. I'd like to just show this picture of Dr. Joanne Gallardo. She's in the lower left and lower right pictures. Dr. Joanne Gallardo was a pediatric resident at that time, and she focused her research on relactation. And this is one of the babies that she was able to successfully relactate, no? So nakikita nyo, sampu siya. Wala ho siyang ginamit na therapeutic milk, kundi breast milk. Because the mother insisted, Doktora, ayoko na pong bumalik sa formula. I want to be able to breastfeed my infant. And you see the successive photos there of how quickly that baby was rehabilitated nutritionally. Relactation works, no? So please, let's respect the IYCF and the wishes of the mother if she wants to do so. You can download this C-MAMI tool, no, off the net. Ang maganda po sa C-MAMI tool, okay, is that it guides you through the nutritional assessment, no, of infants less than 6 months, but it also helps you through the assessment of the mother of these infants, no. Hindi dahil masama yung mga nanay na to. A lot of times there's something going on with the mother that we as health workers need to understand, no. For the infant, triage muna, then anthropometrics, breastfeeding assessment, then clinical assessment. For the mothers, it's not just A, B, and C, but also D. Look into whether she's depressed, she's anxious, or she's distressed, or even if she's on drugs, no? So consider them as victims, not as pasaway or bad mothers, no? So this is very, very important in how we interact with our mothers of SAM children, okay? So dun sa C-MAMI tool, may first line, may second line, breastfeeding counseling and support actions. If you don't have the link, then I can send it through Dr. Judy maybe. There's also yung tinatawag na supplementary suckling support, yung gumagamit ng tube to be able to relactate a mother. And it's also important to engage or involve the family and the community in helping that mother and not labeling or stereotyping them into bad mothers. Okay, 5 minutes na lang. This is the story of baby Ruel. At this time, he was 2 years of age. I hope you can hear me. And he was featured on Jessica Soho's TV show, no? So, kalunus-lunus po, when I first saw these pictures, the video, naiyak talaga ako. And for a 2-year-old to look like this, na halos parang malusog pa siguro yung aso, etc., no? Nakakaiyak talaga. Fortunately, UNICEF, that's Dr. Drew Buko, was able to locate the boy, Roel, and we were able to rehabilitate them using our UTF in the community. Hindi ho siya na hospitalized, no? This is the before and after pictures of Roel. And I'm not showing this to brag that I was involved in the care, but I want to show you this person here. I hope you see my cursor. This person was responsible for saving Roel's life. And why am I highlighting him? He was not a nutritionist, not a pediatrician, not an obstetrician, not a family medicine specialist. He was the sanitary inspector of the barangay in Camarines Norte. No? Kung siya po, kaya niya hong iligtas ang mga batang ito just with support from the health workers and from the provincial hospital director, no? Kaya po natin, lalo na tayo kung pediatricians tayo. I was able to visit Ruel again at 3 years of age, and I'm showing this not to brag, but I just want to make an appeal to all of you, no? This is the first ever book. This is the first ever book na nahaplos ni Ruel. That is unacceptable, no? Yung early child care and development niya, yung first 1,000 days niya, lumampas na nga, hindi pa natin naihabol, no? So dapat holistic sana yung care. When I talk to the mother, and even if you watch the video, you will find that the only reason Ruel survived with that degree of severe malnutrition was because of this. She was breastfeeding. She was breastfeeding. So may immunoprotection siya, but every time she had money, she was buying formula instead of food. Instead of food. And this tends to make me quite emotional because that's what she was made to believe on the TV commercials. That formula will save her, will make her baby better. And once in a malnutrition workshop in Bicol, may nagsabi, candid naman, sabi niya galit ako sa mga magulang kasi tanga kasi sila. Pero I'd like to just make an appeal na sometimes it's not that they're tanga, it's not that they're just absolutely ignorant. It's because they're being misled and they're confused with the messages that we as health workers deliver to them, or that we allow multimedia to deliver to them. So I think those are the ending points now. Just to show you, Roel may be nutritionally rehabilitated at 3 years of age, but he cannot walk and he has no words. Hindi ho siya nakakasalita kahit mama. And this is why the first 1,000 days is so important. And this is the living proof of that. We owe more. We owe our children more. Maraming salamat po.